Good afternoon and Selamat Sore. Welcome back to my no-name channel. I'm Bruce and this is another Bali Covid-19 update for July 4th, 2021. And if you're an American, happy 4th of July. And, well, got lots of stuff. This is going to be a little shorter than usual. I just got back from Ahmed and, well, it was an interesting trip. In a lot of different ways, and I will mention a few things later on. Let's talk about numbers first, as usual. And again, record number of cases yesterday nationally, 27,913. 78% are on Java. And in Bali, 272 new cases, and so that's down a little. We've been up in the 300s, and I started recording this video on Monday because I was going on vacation. I had a 3-day vacation coming up, and so you'll see the numbers have just increased since I started talking on Monday. So we had 272 yesterday, but it was a Saturday. Counts are usually down on the weekends. Okay, so let's talk about the numbers. What are the numbers? 272 new positive cases gives us 51,143. Recoveries, 47,422. Deaths, 1,581. And the number of active cases, 2,140. Wow. This is just shot up. Okay, and what about where they're from? Well, 272 cases are all Indonesians, 239 are local transmissions, 32 cases domestic travelers, and 1 from an international traveler. And by province, Kabupaten, Denpasar 102, Badung 40, Gianyar 35, Jembrana 30, Tabanan 25, Bululang 14, Bangli 10, Klungkung 5, Karanasem 1. Okay, so the numbers are not good. What can we say? Or what can I say? The numbers are terrible. Take a look at these charts here. You can see the numbers nationwide, the number of new cases shooting up, the number of new cases in Bali, and there's a couple of different charts here. One, this goes from May 1st, just to show you in the last 2 months what's happened, and then the other one goes back to March. Okay, so we have a lot of new cases. Numbers are going up nationally in here, and we're in the partial lockdown, and I'm going to talk about that in a minute. But new cases, the vice governor is tested positive for COVID-19. So the vice governor tested positive for COVID-19 the other day after he came back from visiting Gilimanuk port as part of his duties. He was confirmed a positive rapid antigen test, and he said he's not feeling anything. There's no symptoms. He's undergoing quarantine at his official residence in Denpasar. If you can hear that noise in the back, you can. There's nothing you can do about it. This guy my neighbor is fixing his sampan, his fishing boat, and he's doing it all the time. And so it's just noisy because it was really trashed during the rainy season storms. So back to the vice governor. I've been self-isolating at my official residence by myself for 5 days while my wife is in Semeru and my children are in Ubud with my grandchildren. Okay, and according to Dr. Sorjaya, and I've talked about him many times, he said from over 1,000 active cases at the moment, most of them have no symptoms. So we still have enough isolation rooms at our hospitals. He claimed that the COVID-19 vaccine distribution has contributed to prevent the risk of developing symptoms in COVID-19 patients. And so that is good news. Okay, we get some good news out of this. So if you do get sick, You may not show symptoms. Okay, and let's go on to testing, and after the testing, then we're going to talk about the partial lockdown. Okay, so testing is going on around the island still. Everybody in the world seems to agree that that vaccinations are what we need to do. Vaccinations, social distancing, wearing masks. So what about under 18s? Well, there was a story that came out right when I was earlier this week, when I was getting ready to go, that said that the president has announced that vaccinations will be rolled out for 12 to 17-year-olds soon. And according to this story, this was for the Sinovac vaccine, because President Jokowi said, "We are thankful for the issuance of the EUA, the Emergency Use Authorization, by the BPOM, Food and Drug Supervisory Agency, for the Sinovac vaccine, in which it stated that the Sinovac vaccines are safe for 12 to 17-year-olds. And so vaccinations for that age range can soon be carried out." Well, that was earlier in the week. Now, just today, I saw a news story. Indonesia's under 18s to get Pfizer BioNTech vaccine. Minister. Indonesia is planning to vaccinate under 18s with the coronavirus mRNA shot jointly developed by Pfizer and BioNTech. Its health minister said, our health minister said, Indonesia's health minister. So, the Indonesian health minister says, now we're going to get the Pfizer, the 12 to 17-year-olds are going to get the Pfizer. So, as I've said before, things change rapidly here. There's just, every day there's an update on some story. Somebody says one thing and somebody says somebody else. So, if you really want to keep up on this, you need to follow social media, the newspapers, television, if you watch television. So there are a lot of different sources. Okay, so we know that the 12 to 17-year-olds are going to get vaccinated. Are they going to get vaccinated with Pfizer? Because we are going to get Pfizer in here. Or are they going to get vaccinated with the Sinovac? Only time will tell. But they are going to be vaccinated. And so how is the president responding to this surge that we've had now? We're getting basically 20,000 a day around the country, and Bali is up in the 200s. So President Jokowi is officially appointed Coordinating Minister for Maritime Affairs and Investments, Pak Luhut, as the coordinator of tougher COVID-19 restrictions called the Emergency Public Activity Restriction Enforcement, PPKM Darurat. And this was confirmed by the ministry spokesperson, Jody Mahardi, who said that the emergency public restrictions will be imposed on the islands of Java and Bali. However, no real specifications yet. It's been explained that the government is currently formulating the policy for the emergency restrictions amid the surging cases. And the policy will effectively restrict the operational hours of business sectors such as supermarkets, malls, and other essential sectors, and impose tougher health protocols. The spokesperson for the ministry said that people should avoid panicking following the initial news about this policy spread through WhatsApp. And so there has been already in social media, just if you were looking at every message as a light, boy, talk about lighting up social media. Oh, so I hear there's going to be 2-week lockdown. No, there's no 2-week lockdown. Okay, the specifics of this have not been released yet, and by the time I post this, they should be, and I'll add this right here as an addendum more, so to speak. So, I said I was going to do an addendum, update this, and so this is an English language summary of the the content from the new restrictions. 100% work from home for non-essential sectors, and there's a link below if you want to read all these. I'm not going to cover all of them, just the ones I think that are most relevant to most of us. Supermarkets, traditional markets, grocery stores, and supermarkets that sell daily necessities. Operating hours are limited to 8 o'clock local time with a visitor capacity of 50%. Pharmacies and drugstores can stay open 24 hours a day. Shopping centers, malls, trade centers are closed. The implementation of eating, drinking activities in public places, food stalls, restaurants, cafes, street vendors, hawker stalls, both in separate locations and those located in shopping centers and malls, will only accept takeaway and delivery. No dining in place. And I'm going to talk about that at the end in the wrap-up, how that's working. Places of worship, mosques, prayer rooms, churches, temples, pagodas, others are temporarily closed. Public facilities, public areas, public parks, public tourist attractions, and other public areas are temporarily closed. People have asked already, does that include the beaches? Some say yes and some say no. It depends on the banjar. I don't know. The way you find out, I guess, is to show up. And if they turn you away, the beach in Ahmed yesterday where we were was open. I didn't go out on it because I was trying to follow the protocols as much as possible. But my son was out on it with my granddaughter, and he said that, yeah, there were people there, mostly locals, a couple of tourists, not wearing masks. Art, cultural, sports, social activities. Location of arts, culture, sports facilities, and social activities that can cause crowds temporarily closed. Public transportation is limited to 70%. Okay, now if you've been in public transportation, and I used to a lot, do you really want to go on public transportation now? 70% is still a lot of people that you're next to. Wedding receptions are enforced with a maximum capacity of 30 people. A provision of food is only allowed in a closed place and for take home. Domestic travelers using long-distance transportation modes, airplane, bus, and train must show a vaccine card and a PCR test. Masks still need to be worn. It is not permitted to use a face shield without the use of a mask. Okay, so that's the important parts of this. So we're under these restrictions, these community restrictions, partial lockdown. These are probably the most serious ones that we've had yet here in Bali. The governor came out right away and supported the president with this and said that we are going to follow this. So with these new restrictions, what's going to happen with foreigners who are disobeying the rules, continuing to disobey the rules? Well, this is an emergency. Sanction of 1 million rupee does not apply. Foreigners violate PROCES, that's the safety, health and safety protocols, deported immediately. So the 1 million rupiah fine for foreigners, which would sometimes seem to have dropped down to 100,000, is gone. That's no longer there. Instead, foreigners who violate the health protocol will be immediately deported to their country of origin. According to the head of Bali Ministry of Law and Human Rights, Jamaruli Manahuruk, he said, the rupiah 1 million sanction does not apply. This is an emergency. Immediately deported. Jamaruli said, previously, we were still taking quite soft actions, but this time we emphasize that we are not thinking about being soft again because this is an emergency. And this takes effect yesterday, or took effect yesterday. It's in effect now. And I'll talk about this at the wrap-up. And Jamaruli continued, this needs to be known by all foreign nationals who are in Bali. We ensure and provide strict action if foreigners do not follow the health protocol, so we will take firm action, namely strict immigration action in the form of deportation. and its implementation will involve the Bali Provincial Satpol PP. And they will report violations to the Bali Ministry of Law and Human Rights, and the ministry who receives the report will call the relevant foreigner to the detention room, and if flight schedule already exists, the foreigner will be sent home immediately. So we've got the surge in cases, Java, Bali. We've got the new restriction on coming in here and needing the PCR test with the QR code. So how is this affecting us in Bali? 40% of flights canceled after Bali governor announced new entry requirement. Officials from the airport confirmed that 40% of flights to Bali had been canceled after the new entry requirement was announced by the governor. And the stakeholder relations manager from the airport confirmed that 40% of total air travel services from several different cities, such as Jakarta, Surabaya, and Lombok, were canceled on the 29th after the announcement. This new policy for the testing was implemented in order to protect Bali from the surge of COVID-19 transitions and trying to keep the numbers down in Bali so that we can open for international visitors as soon as possible. Before the new policy started, Bali was getting around 8,000 visitors a day. Last week I said 7,000. This article says 8,000. But it's expected to decline in the near future. The stakeholder relations manager from the airport predicted a 30 to 40% reduction of domestic visitors during the implementation of the new policy. He said, "We don't really know why those airline companies decided to cancel the planned flights, but it's the same day as the new implementation begins, and Bali is expected to lose around 6,000 visitors each day." Now, that's a worry. So if there's 8,000 visitors coming in and we lose 6,000 visitors a day because of this new policy, what does that say about what people were doing when they were coming in? Were they really coming in with tests, with valid tests? Or is this the 2 times 24 that you have to have this within 48 hours? Is that too difficult? Is it too expensive? I don't know, but I like this plan. I like the plan that people actually have to have a verifiable document that shows that they are negative when they get in here. Although, as everybody knows by now, you can do this test and still have the virus and just at the start, and it doesn't show up until you get in the island. So as long as people come in here, we're going to have a problem. This should help it though. Okay, let's do a little experiment this week. This is Tuesday, June 29th, and we're going to talk about, are we going to open or not? And so let's see what we've got today. Based on a press conference yesterday on Monday, Vaccinated said that we are going to possibly delay the opening until the third quarter. He said, "We were targeting end of July, beginning of August, but we just have to be mindful of where we are in this recent spike. We'll be waiting for the situation to be more conducive." So, are we going to open in July? Lots of doubts here. And our cases, as you know, have been going up and up and up. We're down at the low around 22. I think that was the lowest that I reported, 22. And now we're up in the high 180s, 190s, and 200s. And so, yeah, this has not been good. Pak Uno said he wanted Bali's daily coronavirus infections to fall to 30 or 40 per day before reopening. And there are questions about actually how accurate the infections are because of a low rate of testing, which according to this article is about 15% of the minimum recommended by the World Health Organization, according to data released by the global health body. And the government, the central government, has prioritized Bali for vaccinations. Okay, we talked about this. Everybody's been getting vaccinated, and our numbers are going up and up and up. Are we going to have the the magic 70% herd immunity, and I've talked about herd immunity a couple of videos ago. You can take a look at it if you want to see what I've had to say for looking at some of the recent articles by scientists about this. So with all the vaccinations that were going on, our numbers were dropping, things were looking good, and now we're up again. And if you take a look at Java, a lot of hospitals are at 100%. I think today I saw a 90% average. So things are bad in Java. We're at 20,000 a day, 19,000 a day, 18,000 a day. We are the basket case of Southeast Asia right now, unfortunately. So according to this article here, according to PAC-UNO, about 71% of Balinese have received the first vaccination, and the target of full vaccination for 70% could be achieved by the end of July, he said. And as I've mentioned other times, a lot of people were just getting their first vaccinations now, last week and now this week, because of the threat of not being able to get any government services. And so people that didn't want to get vaccinated or were holding off have been lining up and waiting to get it. And so are we going to have a fully vaccinated island by the end of July or by August? Not if we're waiting for 12 weeks. That's going to be into September. And as I mentioned last week, just at the end of the video, there are new restrictions on entering Bali, so you have to have a PCR test within 48 hours of traveling, and it has to have a QR code on it to make sure that it is not counterfeit, because that has been a problem here. Fake vaccinations. And so that's where we're at on Tuesday. So let's talk about reopening. This segment is about Bali's international tourism reopening, all but delayed, according to senior minister. According to the Indonesia's coordinating minister for maritime affairs and investment, Pak Luhut, he has all but confirmed the reopening of Bali for foreign tourists has been delayed. So when he was asked about this, he said, in regards to Bali, I think you can answer it yourself. There's no way we can reopen with this Delta variant, so we're not even thinking about that now. Right now we're thinking about how to scale down the COVID crisis. As I mentioned in the previous segment, Pak Sandiaga Uno talked about the possibility of delaying the July reopening, but this is a little more forceful. Pak Luhut right now is in charge of this emergency crisis restrictions, and with the numbers the way they are we going to open in July? Boy, that's a long shot. August, September. As I've said before, if it was me, I wouldn't book any tickets before September, even if airlines are saying that they have international flights to Bali. Until you hear something from the government, it's a no-go. More on vaccination vacations. The Minister of Tourism and Creative Economy is getting ready to roll out the plan at the end of July, and the governor of Bali hopes that it will be ready by then. So this is something that's not going to die. It's in the news again. I've talked about this before. This vaccine-based tourism plan is supposed to trigger the enthusiasm of the tourism industry and jumpstart the economic recovery here. This is based on a press release that Pak Sandiaga Uno had on Monday, June 28th. And in this meeting, the governor of Bali said that the vaccine tourism program was born thanks to President Jokowi, who suggested this himself, and therefore the governor is supporting this plan developed by Vaccinated Uno. And according to the governor, the Balinese people and stakeholders support the Bali vaccine tourism can be open by the end of July. And on the issue of the Work from Bali program, it's been denied that the Work from Bali program has contributed to the increase of the COVID-19 transmissions here in the island. The governor said it's true that there's been an increase in cases, but that is outside the WFB destination. The data for the increase occurred in Tabanan and Karangasem, while the WFB destinations were located in Badung Regency. And the 3 free COVID corridors, FCC zone, Sanur Ubud, and Nusa Dua, are supposedly 100% complete in vaccinations. Vaccinated Uno stressed that the vaccination vacations is not going to cut into the supply of vaccines available for residents of Bali. He said, I can state that our vaccine supply is sufficient. And for Bali, the priority will be from the president. So this is not to reduce the Bali vaccine by 6 million doses. We hope to finish it before the reopening of Bali, July 2021. Of course, you'll see in a later segment that date has been pushed back, most likely. And more on vaccination vacations. So the free vaccine tour to Bali for 14 days. Here's the price list, this article. So this is a package for domestic tourists who want to work or vacation on the island for 14 days. The prices will start at 4.1 million rupiah per person. That includes the 2 Sinovac injections, but it does not include airfare. According to the TX Travel President Director Anton Thedi, the concept is 14 days, 13 nights. The price starts at 4.1 million. This includes 2 vaccines and, of course, other facilities. It doesn't mention what the other facilities are. Anton said his party has deployed 256 branch offices and 12,000 resellers throughout Indonesia to promote tour packages plus free vaccines to Bali. We will add more products, he said, not just the ones that are currently available. We've tried several locations, such as the Ubud area, as well as other areas. There are so many things that we can develop together. The most important part of this vaccine tour is how to increase the length of stay, which may now average a week to 2 weeks. He also added his experience of living 2 months on the island of Bali while vacationing here. He said that Bali is still at the top of mind for domestic tourists, and in addition to vacationing, business people often like to spend their working time in Bali. He said, I find it easier to meet business partners in Bali than in Jakarta itself. Next is Bali as an international culinary center, so it is suitable for all kinds of people who want to eat anything they can. Okay, that just struck me as very funny. And of course, Bali is also very good. It has beaches, has mountains, has lakes, has a hot place, has a cold place. I think this is one of the reasons we can now start vaccination tourism pilot in Bali. Okay, so packages are going to start at 4.1 million. What's that going to include? A hotel room. I don't know what else doesn't include the flights. And what about the flights? Well, there's some information about what's happened with the domestic flights now that the new requirement that people that come here have to have a negative PCR with a QR code to make sure that it is not false, not counterfeit. Okay, wrap-up time. Now, this week I didn't talk about any naughty foreigners because that kind of comes under the news that foreigners are going to be deported immediately if they violate the health and safety protocols. And so we've got, what do we have? We have huge numbers. records continuing to be set nationwide. Bali numbers continuing to go up, as you've seen from the charts that I put on earlier. The president finally pushed into increasing the restrictions for Java and Bali. And this is for Java and Bali, not for any place else. There are restrictions on movements, kind of restrictions. Now this has gotten really hysterical. People are just, and people who usually seem kind of sane on social media, or who seem sane on social media, talking about you can't go out of your house. It's been suggested, you're advised not to leave home unless you have to. It doesn't say you can't leave home. Restaurants are open, not for dining in, for takeout, takeaway. Supermarkets are open. The pharmacies are open 24 hours a day. But the idea is to restrict movements as much as possible, social distance, wear a mask, get vaccinated. So, is this going to work, or is this too late? It seems like you would think that the Delta variant is here already. We haven't had any official word that it has. I talked about before that the governor ordered the health ministry to get into gear and look and see if the Delta variant is here. But with the increases, it's quite possible, and with the continued movement from other islands into Bali for work, tourism, whatever, it's highly likely that the Delta variant is here. Now, is that going to spread like wildfire here, like it's spreading in Java, in Jakarta, and other cities? It's not clear. Are people going to follow all of these restrictions, these new restrictions? Okay, let's talk about that for a minute. Now, I had a vacation planned in Ahmed for a couple of months, and so getting my whole family together when they get off work was difficult, but we did. And so we knew that there were going to be restrictions, but they hadn't been announced yet. So we went 2-day vacation. We got there, restrictions were announced, and so there we were. Okay, but at that point there had been no specifics, and then the specifics came out. Restaurants were not allowed to stay open. Okay, so we ate in the hotel. We stayed in the hotel. We went out to go to the supermarket just down the street, and we came home today, and there was nobody on the street. No officials, no police, no military, no kind of government authorities checking anything. When we were in Ahmed, what was going on there? The first and the second day of the restrictions. Foreigners that I saw, and there were some, thank goodness Ahmed has some foreigners around, but not wearing masks. Almost all of them not wearing masks. Locals, a lot of locals weren't wearing masks either. Maybe 25%. Maybe 25%. It was definitely nowhere near 90%. When we hit the road, we were on the road going from Ahmed to Singaraja. People had masks on, people didn't have masks on. We didn't come across one foreigner on the road. We did come across a lot of Indonesians, and some of them were wearing masks, and some of the people on the side of the road who weren't traveling in stores, some of them had masks on and some of them didn't. So, are people taking this seriously here? My first impression is not that seriously, because everybody is not masked up. Social distancing, I don't know. There was a talk about there's a lot of cremation ceremonies now been going on right now, and that those had to be limited in terms of number, and they had to have permission to do that. We came across a Naben. It was a big one, but it was the day before restrictions. We didn't run across any today. People Congregating, yeah, there were people congregating all over. Not in big numbers, though. 4 or 5 people. We didn't see any mass gatherings. So, is this going to work? I don't know. I hope so. I hope that it works. I hope that by the 20th, because this runs from yesterday, these emergency restrictions from the 3rd to the 20th, they can be extended. If the numbers continue like they are, most likely it will be extended. So, we need to go with the flow. There's already a lot of pushing from some foreigners here, and I don't know where they're from, about I'm not following these rules, I don't have to, this is fascism, this is whatever. Follow the rules. We need to go back. Schools are closed again. That was another one. I don't know if I mentioned it. That's another point there in the restrictions, the list of restrictions I went through. Schools are still going to stay closed, so my granddaughter is still going to do online learning. So, okay, what's some good news? Can we pull some good news out of this? Yes, some good news is the president's doing something, and the governor of Bali agreed with it, and Karangasem, the Bupati of Karangasem was not included in the original list of places that the emergency restrictions apply to. The Bupati of Karangasem said, we are also going to take part in this. It's important because people move from place to place. There's a lot of movement around Bali, so we should not be left free to do what we want to. We should be following these restrictions too. Good idea for him. So all we can do is wait and see. As I say every week, if you're planning on coming here, I wouldn't plan on anything soon. If you're here already, follow the health protocols. Do what you can. Wear a mask. If you're getting vaccinated, get vaccinated. If you haven't been vaccinated, you're going to need to be vaccinated to get on planes. They're already making these rules about having the proof that you've been vaccinated. And I'm not going into those because I wasn't quite clear about exactly how they're applying them. Tomorrow, Monday, things should be a little more clear, especially if you're here and you want to leave, because apparently a number of foreigners are leaving now. That Bali is going to be in kind of a lockdown, and they're not going to be free to do what they want to, I guess. So, good. So, good news there. Bad news, of course, is in the numbers. Weather's great, as usual. Sea is beautiful. Let's hope that things get better. Let's hope that Jakarta gets to where they can deal with this situation health-wise. Right now, our hospitals are okay here. The cases that are showing up don't seem to be really severe for vaccinated people, but that remains to be seen with the Delta variant. Okay, so thanks for viewing. Stay safe, follow the rules, be kind to someone today. I'll see you next time.